Biology is more than a class many of us worked hard not to fail. Some call it the science of the century. Hello, I'm Charna Davis-Wiese, and welcome to UCF Profiles. Scientists working in quiet labs have changed our lives in ways we cannot begin to comprehend. And right here at the University of Central Florida, many are trying hard to continue that legacy. Please join me in welcoming Dorilyn Hitchcock, who is the director of the Medical Lab Science programs here at UCF. Thanks so much for joining us. You know, when I was learning about you and what you do, it really opened my eyes as to the very different types of careers there are in biology. And you know, what I said about trying hard not to fail it, when I was in college, the first biology class I had to take, because I didn't take the entry-level courses, was like invertebrate biology. I don't think I ever despised anything more in my life. I'd have to sit there and read about it, but it's more than just memorizing things that you feel like you're not going to use. Biology has this huge world of opportunity for people.
Oh, without a doubt. Within the whole science of biology, it's broken off to the medicine side, and within the medicine side, of course, is the research in the pharmaceuticals, and even splitting off from that and going on to the other side, the forensic side, that has really made it much more exciting. It's not just strictly memorization anymore, it's pure application. Once you know the basics, what can you do with it to help solve problems as far as diseases and again, pharmaceutical products to treat those diseases.
And you talk about forensics, you know, that's so huge on TV now.
Yes.
And I'm sure there's so many people wanting to do that. And I imagine that many people didn't think of those people as biologists.
Not at all. And unfortunately with CSI, what it has done is, well, it's certainly as an advantage, opened people's eyes to what the biology side is. The people at the crime scene usually are not the ones doing the testing. It would be the biologists.
They don't bring a little bag with them.
It's the laboratory scientists that are actually doing the DNA work, that are actually doing all the chemical testing behind the scenes. So CSI did us a fabulous favor in the fact that it opened up a whole new arena for people to see. But what people have to realize is the people collecting the evidence are not the ones doing the testing.
They just make sure they get it there as clean as possible.
As clean as possible. And the exciting part is using the equipment and the DNA techniques that are out there to determine, you know, on samples that are hundreds of years old even, determining who it's from.
And it's only going to get bigger and better and more interesting. Mm-hmm. And we were discussing the people going into fields of science or a high school 11th grader. Like I told you, with me, I had no idea what I wanted to be. I was looking through the course catalog for the university, thinking, it was almost like shopping for a career. And you had said, in sciences, you usually think nursing or becoming an MD.
Right.
And they don't realize
that there's this whole group of allied health programs in between, and especially something like laboratory science, the first 2 years are identical to a pre-med program. So as you're doing that track, you can see what other things are out there. In the laboratory, we're doing pretty much all of the diagnosing ahead of time. The physician has the patient in front of them, and they're looking at the clinical symptomology. Then the lab tests are going to confirm and or diagnose for that physician what exactly is wrong. So again, we're behind the scenes. The laboratorian is not face-to-face with the patient usually, but we usually have the diagnosis all together with our lab results before they're sent out to the physician. So it is very exciting, but people don't think about that. They, especially parents, think medicine, nursing, because those are the high-profile fields.
So how do they find out what's available? I know, and you know, I hate to use my experiences all the time, but some people might have had similar ones. I had decided what I wanted to do, and I have much older siblings who said, no, you need a more practical career, and my brother talked me into doing a medical technology track. Mm-hmm. my first semester in college, and I had done all humanities and art and literature. So he loaded me up with all of this science. And it was way more classes, 3 more classes. It was like 9 more credit hours than anybody else was taking. And I was so drowning. And then because my grades were so good, I was allowed to go take this other medical technology course, which was literally feces examination. And I thought, this is my reward. But in reality, you told me that really is part of it.
That is part of it. Any kind of bodily fluid is, or anything that can be obtained other than tissues, of course, is what we are analyzing from patients to help in a diagnosis. Working with unusual body fluids is part of it. I wouldn't say it was the favorite of most people, but I have an instructor that teaches parasitology that is so excited about parasitology and finding parasites and finding them as soon as possible, so that again the patient is treated as quickly as possible for the disorder.
Not too long ago, people died from Giardia and things like that because nobody knew what they had.
Correct.
But the truth of the matter is I never made it to that next semester. I changed to journalism, but I had a friend who did, and she said that course was really fascinating. It was very, very tiny specimens and samples.
That's correct. You don't need large amounts to be able to look for that type of thing. But I mean, if you take away something like looking at stool samples and consider blood samples, the areas that I teach primarily is hematology, coagulation, those types of things. We're looking at and identifying unusual blood cells that shouldn't be there and helping in diagnosing if it's a leukemia, if it is a cancer that has migrated to somewhere else. We look at spinal fluid and see, are there cells that are in that fluid that shouldn't be there? And then immediately treatment will be started to correct the problem. So we are, even though we're not directly involved patient-wise, we are first line.
And not only diagnosis, as well, biologists are working in pharmaceuticals and for treatment as well.
That's correct. A clinical lab scientist can go into research and be very much engaged in the pharmaceutical industry. Biotech is pretty much pharmacy related, looking at the disease process, identifying the cause of the disease, and whether it be in today's world molecular changes, can we pluck out the bad gene, put a new one in that would make everything okay? Or in the case of stem cells, we have a PhD faculty member that is working with stem cells obtained from blood and bone marrow. Can we alter that stem cell to turn it into a nerve cell that will regenerate? So these types of things are all potential areas that laboratorians can work in.
I remember when I was working on the news, I did a story on, I can't even remember what it was, but I visited a biologist in a lab here working on a pharmaceutical, and he had his computer screen and he was showing me molecular diagrams and said, just like you said, well, put this out and put this back in. And it was so mind-boggling to me to think about how he can do this on his computer and actually make it work in the real world, and end up with a medicine that could actually make this work. That was, I couldn't see the connection there, but that's what they'll learn in the program.
That is correct. And even the research that I did with Harbor Branch Oceanographic Institution, I was there full-time years ago before I came to UCF as a scientist. We traveled all over the world on research vessels collecting lower class invertebrates looking for potential pharmaceutical products. And this was in 1985, and there is a drug right now that's in phase 3 clinical trials in Europe as an anti-cancer drug from a sponge that was collected with us, and I did the research on it. So it takes a long time, but it is very, very exciting work.
So how do you do that? Do you actually go out? Do you go out into the field when you were with them, when you were at Harbor Branch?
Yes, they had the research vessels, and they had submersibles that could go to 3,000 feet. And so the science crew would be involved in the collections for deep water, And then shallow water with scuba equipment, we would be collecting these things, and on shipboard would be doing the assays. I was not a marine biologist. I was not trained as a marine biologist, but as a laboratorian, I could do the assays. When the materials came up, we had a microscope that was
right there on the boat.
Right on the boat, and I had everything I needed to do the testing right on the ship. So if it showed any kind of activity, we were there to collect a little bit more to bring back to the main facility to work out.
That is just that's too interesting.
So Novartis has one of our chemicals as well that they're working on as a pharmaceutical product, also an anti-cancer drug. So very exciting work, figuring, okay, the land has been tapped so much for natural products and natural product chemistry. Can we look at marine sources that have been around so much longer? Have they developed any kind of chemicals that have allowed them to have an evolutionary edge? So that's what they were looking at.
It's just amazing to me to think that you could that a biologist could think of all the sea life and pinpoint the sponge that could actually end up helping fight disease one day.
It's hit or miss. It was collecting sponges and doing massive amounts of screenings on them.
It's not as easy as it sounds.
No, it isn't.
It's like, oh, here's one. How about this one?
And so we had marine biologists that specialized in sponge taxonomy that would help identify the sponges, and again, not knowing what kind of chemicals were in them, looking to see. And then as a spin-off for that, as I've work part-time for them, we have this massive, or they have this massive collection of what we call macroorganisms. Now we're looking at, all right, is there any kind of symbiosis with microorganisms within the sponges, because the sponges are essentially big siphons that would make this chemical and make it in much higher quantity, of course, would make it much easier to bring to market. So the big emphasis was switching to the microbiology side, and for the past 11 years, that's what I had been doing, was helping to isolate and identify microorganisms within this vast collection that was there.
That's one thing that is so true, that there's so many years of research and work until you get to the, hopefully, get to the point where you find what you're looking for. I can't imagine how good that feels to work so hard for so long and then get to it.
Mm-hmm. Again, the product that I was working on in 1985 is in phase 3 today. So that's how long it took for it to get to that point. But it is very exciting. I'm extremely proud to have been a part of that. I won't have any recognition on any of it, but knowing myself that it was done, I mean, I can't think of anything more rewarding, and I should take that back, other than what I'm doing today, which is training people to be able to do that kind of work.
And I bet those anecdotes, the stories that you have to tell them, really makes it come alive as to why you do it.
I think so. I think they get to see that within medicine, again, within the laboratory, there are so many, I tell the students, there are so many doors this degree will bring you to, whether it be research, whether it be a hospital laboratory, whether it be a government lab such as CDC, whether it be a forensics lab. The doors are all there. You decide which one you want to choose. If the choice is you want the immediate Orlando area, you have a job. Our graduates have 3 to 4 job offers before they graduate.
That's what I was going to say. They're insulated from a lot of the market fluctuations that so many of the rest of us, are slaves to.
Especially today with, number one, the aging population. For aging population, so more medical things are required because of the aging population. On the other side of that, the aging population is those people in the field retiring, leaving this big void of employees. So that's why the job market is incredible right now. If you were to look in any of our national journals, you'd see the vacancy rate is as high as 40%. So, and that's nationwide. That is not just here in Orlando, or Florida, that is nationwide.
Well, I'm ready to go back to school. We'll be right back. We're back. We're talking with Dorilyn Hitchcock, and we're talking about biology and how much more interesting it is than I experienced when I was in college. You know, it's really a shame, because I think that people probably shy away from careers in the sciences because they feel intimidated by it. And that's probably what happened with me. I was intimidated by this big fat book of things to memorize, but you make it come alive. You show us what it does in the real world.
Right. The true application of it with any kind of degree. You base fundamental information and then go into higher and higher levels. With biology, you're going to be given pretty much what is a cell, how does the cell function, but you take that into high-level application. All right, this particular metabolic pathway in the cell causes this to happen. Well, what happens if it doesn't work anymore? What is the end result of that? So if you give that approach, all of a sudden, wow, this is pretty exciting. It's not so bad to have to memorize that particular pathway of a cell. What I tell students about chemistry from my own experience is general chemistry to me was a lot of math. I wasn't that great in math, and it's like, all right, I can do this, I can get through this. Organic chemistry was, oh my God, I've got straight memorization here of molecules. What does this mean? Biochemistry brought it all together. All right, now I understand why you needed to know this particular chemical, because it fits into this pathway that allows this to happen in your body. It came alive. And so I try to impress the students that get through the background information doesn't seem so important to you right now and almost boring, but the end result will be a very exciting end product when you're all done.
When
you
start
get
to
to
crawl
put it all
before you
together.
walk.
Yes, and you get to put it all together and go, wow, okay, now I understand. Why do we need to eat carbohydrates? Why should we be limiting our carbohydrate intake? What happens to us when we do? What do we see as changes in blood, urine, in response to changes in dietary or in even environmental changes?
All of that stuff starting at the cellular level.
Correct.
I imagine that what you've seen, you talked about working in 1985 at Harbor Branch, in the degree of the level of sophistication of technology and what has happened. I mean, if somebody told you in 1985 the kind of things that you could do technologically in biology, you probably wouldn't have believed it.
No, the crude testing that I was doing to determine activity has changed so dramatically to go to now specific chemical pathways to see, will that chemical impede that pathway? We weren't at that level at all in the mid-'80s, at all, to do what we call mechanism of action studies. We know a particular pathway, we know what that pathway does. Can we subject that pathway to this particular chemical? Will it alter it? Will it stop it? Will it slow it down? That's what we're looking for in pharmaceuticals.
How about, what do you think is going to happen in the next 10 years?
10 years?
What's the big thing? What's your big wish that you could have for biology?
Well, again, strictly speaking, laboratory side of things, the sophistication in the equipment, we're not going to be doing so much hands-on pipetting and manipulation with our hands of body fluids of any kind. It's going to be so robotic. We're going to be more than likely closer to the physician and the patient, because we'll be able to say, okay, here we've correlated all these lab results. This is the next thing you would do to help treat this patient. This is this specific drug you should use, and this will prevent this from happening. So more looking at prevention of diseases, and possibly, and I think for sure molecular level, saying, okay, we can correct this problem, we can either insert this gene or insert this stem cell and have it say it's going to become this type of cell and cure the patient.
It is amazing when you think about the things that are possible You know,
it's
just the cloning discussion that seems to have quieted down now is really nothing next to what is going to be possible on the horizon, and people debating about, well, you know, what if you do have this gene in your family,
Right.
and what if people do get that information? So it opens up this whole other world.
Oh, a perfect example is, for so many years we've been told cholesterol is the bad guy, you know, for heart disease and any kind of vascular disorders. Cholesterol was the bad chemical. We're realizing now cholesterol is playing a role in it for sure, but there are so many other factors involved, looking at the coagulation system and the inflammatory responses, saying, okay, if we slow down either one of these, we're not going to have the clogging of the arteries, because we're not going to be having the inflammatory response so active. Slow that down, the person maybe will have more symptomology, so that we can treat and slow it down and prevent it completely from happening.
Did you have, you know, you talk about getting through classes, just like if I had known probably that if I actually went to the next level and continued with the sciences that were trying to get to the good stuff. Did you have an aha moment? I like to call it an aha moment, where you realize this is my passion. Because as you said, all the people I meet, the professors here, you wouldn't have studied so long if you didn't love this. Did you have a moment where, I mean, when you were a little girl, did you say, Mommy, I want to be a biologist?
No. Actually, I think I'm a unique individual in that it happened in the 6th grade. And of course, I'm dating myself here by saying my 6th grade teacher had brought in a whole stack of colored brochures, all right, that was unusual for us to have, on Union Carbide, and the fact that they had just designed an instrument to treat cancer by radiation. And I was just so enthralled by all of this information about cancer. I came home and said, I think I want to work in cancer research.
What did your parents say?
And my parents were like,
yeah, right.
Okay.
What do you want for dinner?
Yeah. What does that mean? So I did the researching myself. Of course, this is not in the age of computers or anything.
No, this is just from a 6th grade teacher just exposing you to that one thing.
And it just caught me.
Nothing in your life that had made you worry about cancer or anything?
No, just the way the brochure was presented was, you know, that cancer was one of the leading causes of death. In the 6th grade, you don't think about things like this. I really liked science you know, in the 5th and 6th grade. It wasn't science projects at all that got me into science, but
you realized that there was a career in it.
Here was something that I was just so interested in. The other parts of science, like about astronomy, and that's not an interest at all, but about cells, I just had this real interest in. So found something like medical technology at the time it was called, and said, well, here's a field, and again, I'm dating myself, where, you know, women's choices were not what they are today. Usually you chose teaching, nursing, or secretary, okay? So here I could use science, but yet I could still help people. I didn't want to be a nurse. I wasn't into the patient contact. I loved looking in microscopes. So when I was in high school, I was in the nurses club, and when we went to volunteer, I volunteered down in the lab. I would go down to the lab and I would help the woman there that was doing all manual procedures, and I just was so excited about what she was doing that I knew this is what I wanted to do.
You're not the first one here in Profiles who said, I found this out very early.
Really?
We had a snake expert on who said, when I was in 3rd grade, my mom brought a book. And that was it. It was the key, and it was the one tiny little piece of the puzzle of your life that really guided you.
What I've been trying to do, because that's what helped me, is I've been trying to go into elementary schools with a microscope and slides and saying, okay, here's a leukemia cell. This is the kind of work that we do to see maybe I could do that same kind of job that my 6th grade science teacher did, probably by accident.
What kind of response do you get from the kids?
Well, they're very excited about looking at blood cells, and of course very excited about the microscope and how it works and everything. It's interesting. They want to know if they were to do this, could they become a doctor?
There we go again. But thankfully, you are there to teach them about all of the things that are open to them. Dorilyn Hitchcock, thanks so much for joining us.
Well, thank you.
I've really learned a lot. I'm sorry I didn't stick more with biology, but then I wouldn't be doing this.
You wouldn't be doing this.
I'm Charna Davis-Wiese. Thanks for watching. We'll see you again next time on UCF Profiles.